interpreters, our ASL interpreters, who have done an amazing job throughout this healthcare crisis. I want to thank them for always being here with us and getting the information, the news out to folks. They play a critical role in making sure that everyone has access to important information that we want to share with the public. I apologize for being a few minutes late. We were getting new information, which we have updated numbers. And as of yesterday, the state numbers, we can confirm 16,790 cases of coronavirus and 433 people have lost their life. Today's Boston numbers, in total, we have 2,812 cases of coronavirus in Boston with Boston residents. That's up 310 from the day before. So if you really look at the numbers in the last 5 days, we have significant number increases here of positive cases of coronavirus, and today is the largest increase we've experienced since the beginning. We have 4 new deaths in the city of Boston, which brings a total of 34 people, residents who have lost their life to the coronavirus. As I said yesterday, our city continues to pray for the families of the loved ones who lost loved ones here in Boston and the Commonwealth, and we want you to know that you're certainly in our thoughts and prayers every day. This pandemic has reminded us how precious life actually really is. It's shown us how strong, generous, and resilient people can be. It's shown us how much we can accomplish together when we work together for the common good. Over and over, people are stepping up to support our efforts and to support their fellow Bostonians. We're getting it done because it has to get done. And that's what a strong city does. We're entering the most crucial part of the outbreak. We're at the beginning of the 2 to 3 week surges in cases, and that will be very difficult for many people in our city, including our entire city. That's why we're doing everything we can to be prepared. We're increasing our medical and care capacity for vulnerable populations in hospitals. We're ramping up resources for our first responders and our frontline workers to make sure they have the support that they need. And today I want to announce a couple of the next steps. We've turned, as you know by now, and the governor talked about a few minutes ago in his press conference, the BCEC into the temporary facility called the Boston Hope Medical Center. 500 beds will be dedicated to the patients struggling with homelessness, and the remaining 500 will be for other patients. We're expecting to be ready and treat unsheltered individuals at this facility as early as tomorrow. The center is a collaboration with the city, the state, Partners Healthcare, Ascension, the Boston Healthcare for the Homeless, and many other folks that helped get this facility up and running and possible. We're also appealing for staffing support from the wider medical community. Medical providers who wish to work at the BCEC and volunteers who wish to help out can go to partners.org/BostonHope. That's partners.org/BostonHope. I also have some announcements on the temporary housing for our frontline workers. Some local partners have stepped up to provide 240 beds for first responders and shelter staff. Northeastern University is providing 135 single occupancy rooms in one of its dorms for Boston's first responders. This is for first responders who need to be self-isolated and reduce the risk of exposing someone at home who might be especially vulnerable, like seniors or someone with underlying health conditions. Boston University is providing 75 rooms to shelter staff who work at Pine Street Inn. They will give some of these hardworking people and frontline staff the ability to practice physical distancing and get some much-needed rest. Hotel Boston in Brighton is providing 74 rooms for Boston's first responders who have tested positive or may have been exposed to someone with COVID-19 and are unable to isolate at home. I just want to take a minute to thank President Joseph Ayoun from Northeastern University, President Bob Brown from BU, and Hotel Boston for making these spaces available for the people who need them the most. I can also announce that we're secured 50 beds, improving physical distancing in veterans housing. The New England, and I think the director Andy's here from the New England Housing today, the New England Home for Veterans will move as many as 40 to 50 veterans to a former nursing home facility in Brighton that is currently vacant. The property owners, Jeff Furman and Mike Ageros, approached my office and let me know that they wanted to help. They offered up the property for whatever we needed it for, and we decided to use it to help veterans in group homes. Jeff and Mike worked to restore the power and water and make all the repairs necessary so the veterans can be comforted. They did this at no cost to the Home for Veterans of the City of Boston. I want to thank you, Michael and Jeff. Your acts of generosity may save lives, and we will never forget it. It's important that we support everyone on the front lines of this crisis. In addition to housing, we are providing first responders and shelter staff with housing for healthcare workers is being made available to Manual College, Mass Art, and Simmons University. They're working with Beth Israel Hospital, Brigham and Women's Hospital, and Children's Hospital. And over 1,000 parking spaces have been made available, 1,100 actually, have been made available to hospital and healthcare workers in the Longwood area by the Mass College of Art, Wentworth University, the MFA, Windsor School, Manual, Harvard, Simmons, and Boston Latin. I, too, want to thank all of these institutions that have stepped up and offered the support. I also have an announcement on our work for preventing foreclosures for homeowners. Since the beginning of this crisis, we've been working on ways to ease the burden and give flexibility on all kinds of housing costs. We've halted eviction proceedings in the city. We've dedicated $3 million in city funds to help renters. We've extended due dates for property tax bills. We've also been working with banks and lenders to provide relief for homeowners who are worried about making mortgage payments. Today, I can announce that we've secured agreements of 12 of the largest housing lenders in Boston to defer homeowners' mortgage payments by 3 months and longer if needed. They also agreed not to charge late fees and non-payment to credit bureaus, response to credit bureaus. After the deferral period, homeowners will not be required to pay the deferment payments in one lump sum. They'll be able to work it out with their lenders on a repayment program. This is about giving some people the opportunity and some breathing room in these difficult times. No one should have to worry about losing their home right now. Any homeowner who needs help with their payments because of this pandemic should contact their lender directly and tell them that they need your help. You need their help. You can also contact the Boston Home Center, which can provide more information. Go to bostonhomecenter.boston.gov. That's homecenter.boston.gov. One more time, because I said it wrong the first time. homecenter.boston.gov. I sincerely thank all of our local lenders who joined our agreement. You're doing the right thing, and you're helping people of Boston weather this storm. The lenders that have signed on to our COVID-19 foreclosure prevention agreement so far are Bank of America, Boston Private, Cambridge Trust Company, Century Bank, Citizens Bank, City of Boston Credit Union, Dedham Savings Bank, Eastern Bank, Mortgage Network Incorporated, Prime Lending, Salem 5, and Santander. For a full list of lenders moving forward, go to boston.gov/coronavirus.